Good morning, I'm Mal Anderson and I'm here to talk to you during Men's Health Week about men's health. What is men's health? Is it the opposite of women's health? Is it just about the prostate? Or is it about levelling the score with the emphasis that we hear of with women's health? Well, it's actually not specifically any one of those. We're all aware of the bits that make us different. And in fact, women attend the doctor more frequently than men. And those specific issues can include breast conditions, having or not having babies, cervical screening, or what used to be called pap smears. But many men immediately think of the prostate. Also, they think of sexual difficulties, including erectile dysfunction. However, men's and women's health are just two aspects of general population health. They are not either or binary, but rather are complementary to each other. To put these conditions into perspective, we need to look at the top 10 causes of death in males, according to the Australian Institute of Health and Welfare figures. Topping the list is coronary artery disease, then followed by lung cancer, dementia, cerebrovascular disease, otherwise known as strokes. Then comes chronic obstructive pulmonary disease, which used to be called emphysema. Sixth on the list is prostate and also breast cancer in males, not forgetting that males do get breast cancer. Number 7 is bowel cancer. Then comes diabetes and its complications, blood disorders, and 10th on that list is suicide. So from the list, it can be seen that dying from prostate cancer is 6th on the list. In fact, prostate cancer can be looked at as a condition one is more likely to die with than from. So many of the conditions, however, are common to both sexes, but there are differences in incidence of various conditions between males and females. Overall, it is considered the health of Australians is less than ideal and it can be improved. How do we address that? So men tend to go to the doctor less frequently than women. We're more inclined to have our car serviced more regularly than we are to have our own checkup. Men go to the doctor when we have an accident, we're unwell, something goes wrong, or advised to go along. And that advice may come from hearing talks such as this during Men's Health Week, or when we receive a call from our regular GP clinic to come in for a health check, such as the age-based health checks, which are from age 45 and also for age 75 or greater. This raises the important issue of having a regular GP. By having a regular GP, health and health outcomes can be tracked and managed far more effectively. It is easier to see someone with whom we already have a relationship. Anecdotally, an observation sometimes heard during a consultation is that when a male patient presents, they remark that the wife and kids come here, but I've never been here before. Before getting into the things that can be addressed during a health check, I want to elaborate on one important issue that may come up. That is erectile dysfunction. And it's an important marker of possible impending health issues and may be a marker of cardiovascular disease, diabetes, hormonal disorders, amongst others. It is important to have a regular health review. So when we have a regular checkup, what are we looking for? What are we looking at? What tests do we suggest? Basic assessment includes the following: weight and BMI, and it's important to note that more males are obese or overweight than women. Diet, and our diets generally tend to be inadequate, too many sugary drinks, too many calories. Third is blood pressure. Fourth, lipids or cholesterol. Then comes blood sugar, alcohol intake. Smoking history is very important, with males smoking more than females. Then there are screening tests, and bowel screening for those aged over 50 is an important test, otherwise known as the poo test. A prostate check, mental health, immunisations, and also following up on any family history of illnesses. So to get back to the prostate, the main method of assessment is through the PSA blood test. Your doctor will discuss with you the relevance and role of this test in determining an individual's likelihood of having a problem of prostate cancer. We must not overlook the fact that benign enlargement of the prostate is a far more common condition, and that affects the ability to empty the bladder. Again, your doctor will discuss with you the possible need for a digital rectal examination, probably the single test which scares most males from coming in for their checkup. You may have noted that death from suicide was 10th on the list of causes of death in males. In fact, men are more likely to die from suicide than are women. Men, more than women, find it difficult to talk about emotional matters. Again, this is a good reason to have a regular GP with whom we have developed a relationship. Some of the markers which could prompt us to speak to our doctor are when we feel we're not coping, that we're stressed, feeling down, not sleeping, or someone has suggested that we are not our usual selves. Short of making an appointment to see the doctor, we might feel more comfortable in talking to one of our mates or a close friend. Even that may be difficult, and we should not forget the importance of each of us as individuals being proactive and keeping in touch with friends, and in fact reaching out to them when we think or notice that they're not behaving the same as usual. In summary, the overall health of our general population is of great importance to the well-being of our community and society. Additionally, overall health outcomes across all age groups and sexes are less than ideal and can be improved. The disciplines of both women's health and men's health are complementary to and support each other in this aim. So, when is the best time for a checkup? Well, it's now while we're talking about it. Thank you.